I think the biggest one is really about what is available to you through your insurance plans or your location. Because that is, studies have proven, if you have a myeloma specialist on your team, it doesn't need to be your primary doctor, but at least at some level of consultation, you will live longer. And so I do feel for, where I'm in the Twin Cities, I'm blessed to have a bunch of clinics and two great sites, Mayo Clinic and U of M, right within our reach. But if you're out, I'm from Iowa, so I'll pick on them. If you're off in, remote Iowa, you may only see an oncologist, and that's an issue because they may not be up to date in the current trends. And so I think the thing was that your doctor's seen less than 4 myeloma patients a year, they may, statistically, you're not going to live as long. So long-winded answer, what can be done about it? I think that's part of the awareness to people, and I think through groups like the IMF and other ones, especially now in the case of telemedicine, to make sure that you're accessing the best knowledge of multiple myeloma when you're getting your care. So maybe you still get treated at your local clinic, but I think you can now have virtual telemedicine to bring in Mayo Clinics or bring in Dana-Farber or somebody else to come back in and help you with their diagnosis. Because that's probably the biggest one, is your doctor doesn't know what they don't know. It also comes into some level of insurance coverage, and that gets sort of political. I'm not going to get into that, but on that whole one is you do need to also, we're expensive patients. You do need to have great insurance on that standpoint. And I'm not quite to the Medicare phase yet, but that also gets quite expensive for people. And I know the International Myeloma Foundation is doing a lot to try to address the oral disparity, because Plan A and Plan B, they do a fair amount to be reasonable on it, but Plan D is just, it just kills patients. That if I was on Medicare, I'd be paying out of pocket $10,000 to $15,000 a year. Now there's a lot of support groups out there that actually help fund it, can do some of the co-pays, and even some of the drug companies if you're on private insurance. But it's expensive. So, what disparities come from? Do you have a doctor who knows your condition? Do I have the money and insurance to cover the treatment? Those are, two of the things that I think need to be addressed. Telemedicine and knowledge can address the first. The latter one, IMF's doing a lot, and I like the Oral Drug Parity Act to make it treated in Medicare more like Plan B is a great legislation, and be nice if they can ever, IMF's doing what they can, other people are doing what they can, but it just needs to be passed.